Good afternoon. Welcome to the GMC March membership meeting. I'm Greg Marcus, chair of the GMC and president and CEO of the Marcus Corporation. I'm the new chair. I feel like they've given me like I just got my driver's license and they just gave me the keys to the car. So I thank you for that. And before I begin my prepared remarks, I just wanted to say, today is International Women's Day, and we should recognize that and remember how important the women are in our community who helped and who brought us to where we are today, and what a great reason to celebrate. So let's mark the day. March also marks 1 year of the COVID pandemic. I don't know if anyone has expected the pandemic to last this long, but the silver lining is we have had the opportunity to stay engaged and support our community to the best of our ability. We thank every member for coming together to openly share best practices to navigate 2020. From expert COVID insight to tackling the challenges illuminated by the pandemic, you are all key to keeping our business community safe and providing the tools needed to keep business moving. To begin today's meeting, I invite Julia Taylor to share GMC initiative updates.
Well, thank you, Greg, and welcome to our March meeting, and welcome Greg as our new board chair. Whoops, excuse me. I look forward to working with you over the next 2 years. Greg has many insights that will help guide our post-pandemic strategy as well as our organization. And Greg also has a passion for the Milwaukee community. In addition to chairing the GMC board, Greg is also on the board of directors of the Greater Milwaukee Foundation, the MMAC, UPath, the United Way of Milwaukee and Waukesha counties, and the Milwaukee Jazz Institute. He is chair of the Milwaukee Jewish Federation Foundation and honorary board member of Betty Brinn's Children's Museum. Like most organizations, the GMC's worked tirelessly through the pandemic to provide impactful and needed programming. Recently, our focus shifted to how we apply the innovations of the past year to strengthen our work moving forward. In late 2020, we formed a racial equity and inclusion task force co-chaired by Cecilia Gore and Wayne Morgan. Our charge is to become an anti-racist organization and encourage our member organizations to be anti-racist. At our most recent committee meeting, we were joined by Ian Batista and Teague Whaley Smith to learn how the Greater Milwaukee Foundation has focused on transactional and moved to transformational change. All of our work is through an equity lens in our 3 focus areas, and I'm pleased to share initiative updates since our last meeting. In innovation and talent, the GMC in the Commons continues our partnership with the Home Group for a second cohort of Forward 48, which is focused on building a robust and diverse civic leadership succession strategy using experiential learning, professional development, and exclusive networking opportunities. Applications are now open, and we encourage you to nominate a rising leader within your organization. George Oliver, CEO of Johnson Controls, shared this note after the pilot program in the fall. Johnson Controls has seen tremendous value from our participation in Forward 48. It's the premier program to engage the pipeline of future leadership in our city, including our very own employees. Our participating employees built lifelong relationships with other emerging leaders and got a masterclass in practical leadership skills shared by the outstanding Forward 48 faculty. I appreciate their dedication and look forward to the ongoing growth and development they will contribute to the Milwaukee community. And as you'll hear later, we're also creating ways for Forward 48 graduates to participate in the GMC. We sent an email to all members last week with program details, and we encourage you to follow up with Michael or Isabel at the GMC for more information. In economic prosperity, Scale Up Milwaukee will launch another virtual cohort of Spark this spring, focusing on the growth of businesses owned by women and people of color with less than $1 million in revenue. We also continue our partnership with the Certain Foundation to impact generational wealth in business owners of color through Rising Tide and the Growth Accelerator program. Milwaukee United completed another round of the Anti-Displacement Fund. Last year, the fund supported 111 homeowners with a total of $38,356 expended. This year, the second year of the fund, we supported 116 homeowners for a total of over $88,000. The increase in the payment, which more than doubled this year, is due to the continued rise in property assessments and tax valuations in the neighborhoods approximate to the downtown development. We want to continue seeing investment and growth in both the neighborhoods and downtown, and it's critical we ensure it benefits long-term residents instead of displacing them. The GMC continues to work with the City of Milwaukee, Milwaukee County, and the MMAC on Move Forward Milwaukee, an initiative to raise sales tax in Milwaukee County by 1%. This proposal was included in Governor Evers' recent budget, yet state leaders have announced their intent to remove this from the budget. And while we're disappointed in the expected removal of the budget of the local option sales tax referendum, we look forward to more dialogue on the issue with Representative Voss and Senator LaMatthew and other elected officials. We believe that local citizens best know the needs and issues of their community, and that it's logical and appropriate that we have some say in being able to increase our sales tax rates to raise revenue to fund these needs. Our fiscal constraints due to underfunding still exist, and we do need a solution. In Vibrancy of Place, in January, we began the feasibility study process for the Beer Line Trail Linear Park expansion. We're currently finalizing the interview list for the study and plan to begin the interviews this month. So we hope you'll make time for an interview if you receive a request from us. Additionally, we're planning future events on the Beer Line Trail virtual event series as a follow-up to January's Equity, Green Space, and the Beer Line Trail conversation. And the registration will be sent to you via the newsletter. And I now invite Dr. Raymond, President and CEO of the Medical College of Wisconsin, to share a COVID-19 update. Dr. Raymond?
Thanks, Julia. Appreciate it. And I'm honored to be here today with such amazing women leaders. So thank you. Just want to give a quick update, and I'll just cut to a punchline and say that it's pretty good. Maybe better than we've had since last spring. So sorry for the punchline, but I think this is all good stuff. If we can go to the first slide, please. Give an abbreviated update, 329 positive cases in Wisconsin yesterday. That was about average for us last summer, so we're improving. 8.6% case positivity, down significantly from when we were having Sundays up in the 25 to 35% range. 7-day average 11.7% for Wisconsin. Similar trends in Milwaukee, 87 positive cases, 13% case positivity yesterday, and a 7-day average of 11.8%. Just to put this in perspective, we've had almost 570,000 cases, or PCR documented cases of COVID-19 during the pandemic. So we can go to the next slide, please. Hospitalizations, over 26,000 people hospitalized with COVID-19 in the last year. Trends in the hospitalizations are very favorable, down to 249 inpatients. That's a week-over-week decrease of 41. And interestingly enough, we're getting close to our all-time low, which was 235 last July the 5th. 66 ICU patients in Wisconsin, again down 7 week over week, and approaching our all-time low, which was 65 on July 5th, 2020. We have plenty of ICU beds available, 338, plenty of ventilator capacity. And although our personal protective equipment still is somewhat tenuous, the trends have stabilized and we have adequate supplies right now. Next slide, please. Thanks, Melissa. In terms of deaths, we are approaching 6,500 deaths in Wisconsin since the beginning of the pandemic. There remains a predisposition to deaths and bad outcomes amongst minority individuals, Black and African American in particular, some Asian minorities, and Latinx and Hispanic. Although whites do constitute the most deaths in Wisconsin and in Milwaukee. And I would add that that trend continues to go upward, for the predominant deaths being amongst people that are self-reported as white or Caucasian, primarily because, as opposed to the beginning of the pandemic, COVID-19 has spread throughout every county of the state. Slight male predisposition. Similar trends on the right-hand side of the slide in Milwaukee. Again, a disproportionate representation of Black and African American deaths, as well as Hispanic and Latinx deaths. I can go to the next slide, please. So some key takeaways. Wisconsin is doing better now than during the spring, summer, and November surges. But the decrease has slowed or stalled in most of the rest of the United States. But we in Wisconsin continue to see favorable downward trends. Now, the US 7-day average is 61,000 daily new cases, and that's close to the 2020 US summer peak. So even though Wisconsin seems to be doing better than most of the rest of the US, the rest of the US is stalled, and we have a lot of progress that we need to make going forward. And the US is still routinely reporting 2,000 deaths per day. There are also some concerns about a potential fourth surge, especially as new strains of the virus continue to spread. And I think that's an important wild card that we're going to need to monitor closely. And as some states relax mandates, again, most public health officials would say that the relaxation of the mandates in these states is premature, and in particular, Mississippi, Texas, Florida, California, South Carolina, and Arizona are having significant relaxations of their policy mandates. So again, just highlights it's still critically important to wear masks, to minimize potential exposures by watching your distance and avoiding gatherings, and washing your hands regularly. I can go to the next slide, please. I want to talk about vaccine progress. And again, this is a success story in Wisconsin. We're doing quite well, despite some of the criticism in late December and early January. Wisconsin is a leader. So just want to refresh everybody's memory. There are 3 approved vaccines in the US right now. Pfizer, which is a messenger RNA vaccine, received emergency use authorization December 11th. Moderna, another messenger RNA vaccine, received approval shortly thereafter on December 18th. And Johnson & Johnson, Janssen, received emergency use authorization a few weeks ago on February 27th. I want to make sure that's not the end of the story. AstraZeneca is probably going to apply for EUA in the US in April. That's had more of a checkered history and less acceptance in the countries in which it already has approval than some of the other vaccines. So that's an emerging story. Novavax, a US country, which is close to approval in Europe, is going to request EUA here probably in April. And that uses antigen technology, which is relatively mature, and there is a relatively robust manufacturing capacity. So that could be a welcome new addition to the vaccines available to us. And then CureVac, one that we haven't heard much about. It's a German company, and they use standard technology. They're likely to apply for EUA in Europe in May, and possibly here in June and July. So again, all the predictions that we're going to be able to have vaccines, if we want to have them administered by the end of May, are very likely to turn out to be true. If I can go to the next slide, please. So how are we doing in Wisconsin? If you look at all 55 US states and territories, we are 13th in the number of people or the percentage of people who have completed both courses. 18.4% of our population, or 1.1 million people in Wisconsin, have received at least one dose, and 10.3%, or 600,000, have completed the full course of vaccinations. And those would be primarily the 2-dose vaccines. The J&J is going to be start to be distributed in earnest this week. And just to put that in comparison, the best state or territory in terms of completing the vaccination course is 16.7% in American Samoa. Alaska's in the 15.8% range if you just want to count the states. So we're doing pretty well. I can go to the next slide. I want to talk about Milwaukee. We have lagged behind other counties as a percentage of population either receiving one dose or completing the course, although that gap has really narrowed significantly over the last 2 weeks. So as you can see, 15.4% of the population have received their first dose. And I want to thank the GMC. Many of the leaders that are members of the GMC are faith leaders in the African American, Black, Hispanic, and Latinx communities, and minority leaders in the Hmong community for helping us to bring access to communities at risk and to deal with building vaccine confidence. And then 7.7% in Milwaukee County had completed the vaccination course. And I expect that that gap will narrow for two reasons. One, we are building vaccine confidence and improving our distribution here. And unlike earlier in the pandemic, the distribution of vaccine throughout Wisconsin now is population-based. So we will have equal access to vaccines on a per capita basis compared to other parts of the state. So generally good news there. The next slide, please. Now, currently eligible, lots of folks have become recently eligible. As we know, frontline healthcare personnel and residents and employees of skilled nursing and long-term care facilities were 1A. We expanded to police and fire personnel and adults 65 and older as the first expansions in 1B about a month ago. And educators and childcare workers, individuals enrolled in Medicaid long-term care programs and their personal assistants or their healthcare providers at home, some public-facing essential workers, say in transportation, frontline essential healthcare workers, educators and childcare workers, and facilities and staff in congregate living situations have been or are now becoming eligible for vaccinations. The next slide, please. So when can we open back up? Three things need to happen, and some of them already are happening. So I'm talking about broad scale opening up. First, we need to reach herd immunity, 70 to 85% of people having been vaccinated. Some might say 90%. And this is important because new, more contagious strains are spreading rapidly. The UK version of COVID-19 is going to become the predominant strain in Wisconsin within the next week or two. I think it's somewhere between 35 and 40% of the new cases now. Also, the P1 strain, or the Brazilian strain, has breakthrough transmission. In other words, it is a culprit in reinfections in people that have already had COVID-19. Second, the burden of disease has to be low. Now, we say DHS here, but because we're having free travel throughout the US, this really needs to apply to the entire country. So there currently are only 4 counties in Wisconsin that are considered to have low activity. Those are Douglas, Green Lake, Marinette, and Taylor. But 10 have medium activity with an improving trajectory. 56 counties still have high levels, and 2 have very high levels, Iron and Green. I want to put this in perspective. In late November and early December, all 72 counties in Wisconsin had critically high levels of activity. So we are moving in the right direction. And then finally, the third variable that needs to happen before we can broadly open back up is we really need to know more about these new emerging, more contagious, and potentially more lethal strains. We're really at the beginning of understanding those and how well they can prevent infection. And that would be vaccinations, previous infection, and monoclonal antibody drugs. So the Brazilian P1 strain is of concern for reinfection. The South African B1.351 strain is of concern for vaccine effectiveness. At some point, it is possible that emerging strains may, quote unquote, escape from the immunity that we get from vaccination. We haven't reached that point yet. And I want to point out that we had our first case of the B1351, or the South African strain, detected in Wisconsin late last week. 26 cases of the UK B1.1 have been detected, and no P1 or Brazilian strain yet. But as our surveillance increases and the number of PCR tests that we do increases to expand to whole genome sequencing, we're going to detect a lot more cases. So finally, the CDC just this morning released guidance that basically said, if you're fully vaccinated and you're 2 weeks out from either your 1-shot J&J or your 2nd shot of the messenger RNA vaccines, you can interact with other fully vaccinated individuals in small groups and remove your mask. Again, the key here is fully vaccinated, small groups, can remove masks. Also within your home, for low-risk individuals, You also can remove your mask if you're fully vaccinated and they're not. So an example would be, and probably the one that everybody's been waiting for, is grandparents who are fully vaccinated can hug their grandkids within a home setting. So good news all around, but we still need to have vigilance. So if I can go to the next slide and turn it over. Just these are some perspective slides. We are in the US doing pretty well, 90 million vaccinations, and we've had a higher percentage of individuals who've completed the series, 9.2%, than much of the rest of the world. We're behind Israel, Bahrain, and Seychelles. Also the UAE, for some reason, their data wasn't available yesterday, but I believe that they're in the high teens. We also have a higher percentage of individuals who've received at least one vaccine dose than much of the rest of the country, and we're on par with neighboring states, so we're not lagging behind any of our neighbors. And then finally, this gets back to vaccine confidence. All the vaccines are highly effective, and the differences in reported efficacy really should not be compared to each other, and that especially applies to the Johnson & Johnson vaccine. It is a good vaccine. And there have been no trials that have directly compared efficacy. They were tested at different points in time with different test subjects, different populations, different strains, and different outcome measures. So apples to apples comparisons are difficult. Now, the one caveat that I do want to point out, and this is probably mostly bad luck, but the AstraZeneca Oxford vaccine has really taken a beating just in terms of public relations. It's not been widely embraced in some countries in Europe, especially Germany, and in South Africa, despite being available. This is a good vaccine, but again, they've had some bad luck with some potential side effects that haven't panned out to be related to the vaccine. And a very small study in South Africa that suggested it might not be as effective as the messenger RNA vaccines in stopping mildly symptomatic infections in young people, but it still remains a good vaccine. The next slide, please. These are the curated websites that we use for the presentations. And with that, I'll turn it back over to Julia. Thank you.
Thank you, Dr. Raymond, for your insightful COVID update. Yes, it's Greg instead of Julia, deeper voice. And thank you for sharing, that there's some light at the end of the tunnel, and yet reminding us that we still are in the tunnel, and that we've got to be, that it's not time to declare victory, that it's time to still be cautious, but that we have a reason for optimism. And that's sort of the underlying theme of today's program. Today's program features a group of experts who will share insight on a national, state, and local strategies for COVID-19 vaccination distribution. Locally, we have a goal of vaccinating 80% of the adult population by this summer. And just last week, President Biden announced that we'll be able to vaccinate all adults by May. There's really no initiative more important than this right now. Effective deployment of the vaccines are, in my mind, the keys to getting our lives back. It's how we regain the chance to be with friends, be with family, and normalize our business operating environments. We've done a great job getting by during these challenging times, but we cannot exist indefinitely getting by. The GMC is dedicated to doing our part to meet these goals. We've been in talks with area partners to identify how the business community can support these efforts, and as a result have formed the Business Leadership Vaccine Advisory Group. The committee is being chaired by Dr. Raymond, Christy Garcia-Thomas, Chief External Affairs Officer of Advocate Aurora Health, Christina Bell, Manager of Global Diversity and Inclusion at Johnson Controls and a Forward 48 graduate, and myself. First of all, we hope this is a short-lived committee, not a lot of tenure for this one. Second, we're going to have a few clear goals so we stay focused. The goals are: 1, share with the medical and public health community what the business community needs, including collateral and communication guidance. 2, understand what the medical, public health community needs are from the business community, including in-kind, personnel, marketing, IT, etc., and financial support. Provide guidance as advisory partners on vaccine equity and confidence strategies. If you're interested in participating on this committee, please note so in the chat, or you can email me, Julia, or Heather at the GMC, and we will respond with further information. I do hope we have some volunteers before I have to go out and volunteer some people. This is really important, and it is how we get our lives back. This committee will also plans to co-host a webinar series over the next month to address the vaccine and your business with the Medical College of Wisconsin, the MMAC, VICO, the Milwaukee Business Journal, and the Unified Emergency Operations Center. The first webinar will take place on March 17th. We will email registration information. And now to introduce today's first speaker, we welcome John Daniels. John Daniels, a man who really doesn't need an introduction, but is the Chairman Emeritus of Quarles and Brady and current Chairman of Advocate Aurora Health Systems, is also the National President of the Black Directors Health Equity Agenda. The organization of more than 350 of the most prominent health directors and leaders in the entire United States, which is focused on actionable activity on health equity. John Daniels is also on the National Civic Panel of Pfizer in connection with the COVID vaccine. Welcome, John.
Okay, Greg, can you hear me now?
Yes, thanks, John.
What I was saying, Greg, is congratulations to you for taking on the role as chair of the Greater Milwaukee Committee and for the many, many things that you do for this community. And I was sort of half kidding when I said, I know that we will have fully arrived back to something near normality when I can join you at Jazz at Lincoln Center, a place that you've had also a big impact in the country. So thanks for all you do. You know, I think that it's always almost impossible to follow Dr. Raymond's, because over the last year, we've all learned so much because of the way that he has been able to provide data in a very objective and thoughtful way. And so thank you for that. We are very fortunate in Wisconsin to have some remarkable health providers. And that really has served us extremely well. But as Dr. Raymond sort of highlighted in some of the data, which I hope you'll take a look at, there are some things that we need to focus on even more carefully. One of the things relates to sort of differentials and impact on inoculation for various populations. And Dr. Raymond presented sort of some remarkable data to us today on that subject. It is improving, but it is still a challenge. One of the things that I have had the opportunity nationally to work on with a group of more than 300 people are sort of actionable things that can be taken in various communities that actually make a difference. So together with people like Dr. David Williams of the Harvard Medical School, Dr. David Dawes of the Morehouse School of Medicine, we and dozens of other people have tried to think very carefully about what we can do in our various communities. I won't go into great detail today on those things. The reality is that we all know that COVID has exposed some pretty remarkable consequences of some of the gaps in our health system. And we know that some of the chronic diseases such as diabetes, hypertension, asthma, and the like are in fact exacerbated by what we see. And that's why data is really important. We're at a great inflection point now in terms of, I think, the vaccines, but there are certain populations that we really have to be attentive to, because we're really all in this together and it really all affects us. I love what Dr. Raymond said earlier about the grandparent being able to hug the grandchild, but also think of it in the context of an elderly parent in a nursing home being taken care of by essential workers who are in the community who are receiving or taking less vaccine. So I think we have to really sort of focus on recognizing that we're really all in this together, and the solution to this is really important. In terms of the social determinants of health, there's been an enormous amount of data written on this, and I would suggest to our group here that in our community, we've got Dr. John Maurer at the Medical College of Wisconsin, who's done some remarkable research on the consequences of disparity. And looking at that data is important. We know that from 70 to 85% of certain of the consequences of healthcare are a result of other disparities, i.e., whether it is housing discrimination, lack of access to appropriate facilities, and the like, that have a major consequence. One of the things that's referenced in the material that I've shared with you in the chat is some material from the Kaiser Family Foundation, which indicates this. I want to share with you, however, 3 really quick takeaways that I have observed with the national leaders who've been focused on this. Next slide, please. And those are the following. First of all, that we know that there's an enormous consequence if we don't eliminate the disparities in healthcare. These are the statistics, and no one really challenges. So if we can solve some of these disparities, it'll have a major impact in terms of all of our lives and in terms of utilization of our tax dollars and otherwise. So here are the 3 takeaways I would give you. Focus matters, education matters, and sustained efforts matters. So what do I mean by focus matters? What I mean by that, if you look historically at the wonderful work that the pharmaceutical companies have done, we also know that there was a history that the clinical testing did not test in relative proportions a number of populations. And this raised serious questions both in those populations' mind about certain drugs, and it raised questions about efficacy. Now, here's the good news for all of us. One of the things that we know from all of the drugs that were sort of shown by Dr. Raymond earlier is that there has been enormous improvement in terms of the clinical population that were tested for these drugs. In fact, those companies went to very critical efforts to make sure that everyone got included. So the takeaway for me on that is that with insight and with a focus on really sort of doing the right thing, you can make a difference. So all of the sort of the rhetoric about clinical testing not being sort of proportionately handled, the pharma companies did a wonderful job in inclusion. And I would say that leads to some additional lessons for all of us in our community. What does the second point that I want to share with you mean? And it sort of ties in a bit to what Greg alluded to about his advisory panel, and that is education matters. And let me share with you a statistic that I found really hard to believe, and that's this, that about almost 90% of the medical information provided to the consumers is not readily understood by the consumers. You know, I know when I go to Walgreens and get a prescription and try to read all the fine print, I sort of shake my head. Well, what is the challenge that affects us in this environment? So take into account all of sort of the differential opinions that exist around the vaccine, the testing, and the like, and take into account sort of some of the historical resistance in certain populations to vaccines. And then take into account that we have a communication system that is not as effective as we would like. No one really wants to really hear that, but the reality is that if you're communicating with populations, you have to communicate in ways that are most effective. If there are challenges in terms of information being provided because of lack of internet and the like, you have to have alternative means. Now, here's the punchline nationally that I think has some relationship to us locally. What we have found is that when alternative communications vehicles are used, it dramatically increases the confidence of the consumers in taking the vaccine and leading to the ultimate result that Dr. Raymond's outlined for us, sort of getting to the finish line on sort of the level of immunity that we want in the country. That's what we all need to get to. So what have we seen that really works? We've seen something that, again, Dr. Raymond's reference is that you have to take into account alternative means of communicating, whether they're not-for-profit groups, faith groups, or the like. These have to be an essential part of communication if we really want to get to the finish line. That's bullet 2. What is bullet 3? Sustained efforts matter. Anybody who's thought long and hard about the history of healthcare in our country knows that our advances in healthcare have sort of come at a hockey stick. And if you look back over really 3 centuries of how we have advanced healthcare, there have been certain instances in which we made dramatic improvements in healthcare. And those periods when we have the opportunity to do that are critical because you can dramatically change the landscape. So again, let me share a personal note with you. I'm a Milwaukee boy who loved debating in high school here in Milwaukee. And I'm old enough to remember that my debate subject was resolved that the United States should adopt Medicare for persons 65 or older. And I can tell you, I argued the affirmative and the negative on that equally as an intellectual matter. Well, we now know that the acceptance of Medicare for persons 65 or older has had dramatic improvement for healthcare for older citizens. And I'll tell you, I'm happy for that today. Love my Medicare card. But what's the punchline for us now? It's this. Forget about Medicare. Think about artificial intelligence. Think about telemedicine. And think about what has occurred because of the COVID in opening up the opportunity to dramatically advance ways to advance the healthcare. So I would encourage us in this moment to recognize that sustained efforts, once COVID is, sort of something that we don't have to worry about every day, that we don't lose the notion that we have a chance to pivot and dramatically improve the healthcare of folks. So I put the articles in the chat for you. I want to thank Shamika Mason, who's a brilliant healthcare lawyer who helped me write those articles. Greg, I'm just a sort of a country real estate lawyer, but I hope that those things that I've shared with you nationally, we can use in part in application in our community. Thanks a lot.
There we go. Thank you, John. Thank you for your kind words too. I can't wait to see you at Lincoln Center. Frankly, I'd be happy to see you in blue. And thank you for your leadership. You clearly are not only a leader in our community, but you lead the national conversation. And we thank you for sharing your perspective with us and helping us and helping our community get stronger. We need you. Thank you. Our next speaker is Secretary Karen Timberlake from the Wisconsin Department of Health Services. Secretary Timberlake joined DHS and rejoined DHS in January after serving under Jim Doyle during the H1N1 pandemic. Prior to her return to DHS, she worked for Michael Best and has a history of advising in areas of public health, healthcare delivery, and healthy community investments, as well as business development strategies. Welcome, Secretary Karen Timberlake.
Thank you so much, Greg, and good afternoon, everybody. Really appreciate the invitation from you and Julia and the entire Greater Milwaukee Committee to be with you this afternoon. I'm going to speak fast so that I can cover a lot of ground and hopefully help us make up a little bit of time. There's a lot of good news to share, as you heard from Dr. Raymond, and I also want to touch a little bit on what we see as the role of employers, broadly speaking. I know that that's been teed up as a focus for the Greater Milwaukee Committee as you think about how you help us both manage our way through the rest of the pandemic, however long that takes, and then what happens when we're all on the other side, which, to Dr. Raymond's point, will occur. So maybe just a couple quick vaccine rollout updates. Dr. Raymond gave you a lot of the top lines and really appreciate that, Dr. Raymond, in terms of the great summary. In terms of the Johnson & Johnson vaccine, we are going to receive our first shipment of Johnson & Johnson in the state this week. We're going to get an initial batch of about 48,000 doses in the state. That will complement what we already have and what is coming in the state in terms of the Pfizer and Moderna vaccine. So all told, we will be using the Johnson & Johnson vaccine this week to really emphasize our educator and childcare worker strategy. As you all know, and Dr. Raymond reviewed, we've got these additional groups of people who became eligible on March 1st. We really want to get our educators and our childcare workers vaccinated, so we're going to prioritize them for Johnson & Johnson, while at the same time we're distributing the rest of the vaccine to all 72 counties of the state. To give you just a sense of how the picture of vaccine availability has changed really quite dramatically in just the last few weeks, we're now in week 13 of delivering vaccine. Maybe feels like a lifetime, or maybe feels like 5 minutes, I don't know, probably depends on your role, but we're 13 weeks in. Just 4 weeks ago, we got about 70,000 first doses into our state. This week, we are going to get 138,000 first doses plus the 48 from Johnson & Johnson. So think about that just in terms of an order of magnitude of improvement. So supply is moving generally in the right direction. That's probably the place for me to leave it there. In terms of where vaccine is available, I have shared a number of resources that are going to come to you, I think, as a follow-up communication following this event. But one of the things that I think is really important for people to know is that we now have a new map available on the DHS website that shows where vaccine is available all across the state, including in Milwaukee County. And of course, it's a dense map in the case of Milwaukee County because we have so many great partners who are administering vaccine. But in general, we have adopted a many front door strategy to try to make sure that people all across Milwaukee and all across our state have multiple avenues to get vaccine. We know that that's going to create that access that we need. We also know that access without information and awareness does not equal people getting the shots that we need them to get. And so in addition to the map, we've stood up a new toll-free phone number and a number of other resources to make sure that we can help people understand where to go when it's their turn to get vaccinated. In terms of further progress that's coming on eligibility, the reality of it is that the news on vaccine supply is so good and our vaccinators across the state are being so efficient that we are actually optimistic that either later this week or early next week we'll be able to make an announcement about the next groups of people who will become eligible in April. And following that, what we think the picture for making really everybody in the state of Wisconsin eligible, what that picture looks like for late spring and early summer. So please stay tuned for more on that. With the opportunity to speak to this group of employers, though, I really do want to focus for just a moment on what we see as the role of the employer community. And I think if I could boil it down to three things, it really is education, reducing barriers to vaccine, and where necessary, providing incentives to help your employees get vaccinated. So we did a survey not too long ago in partnership with the Wisconsin Economic Development Corporation of smaller employers. And I realize we have a lot of larger employers on this call, but I think some of the thinking may hold. And we asked those employers what they thought their role was in helping their employees to get vaccinated. About half of them told us they thought they had some role in making referrals. Only about a quarter thought they had any role to play in providing their employees with education. Only 11% thought they had a role in actually making the vaccine available on site for their employees. And an alarming 32% told us that they thought they had no role in helping their employees get vaccinated. So I share that to say, depending on kind of where you are thinking of yourselves in helping your employees connect to this vaccine that we know we all want them to get, we think you have a role to play. And we do think, as I alluded to a second ago, that the most important thing you can be doing is helping your employees with access to good, fact-based, science-based information about vaccine efficacy and safety, vaccine availability, what the plan is for your workplace when your employees become eligible to be vaccinated, what the plan is for them to get the vaccine, whether that's referring them to their healthcare provider, whether that's bringing in an on-site clinic, whether that's encouraging them to look for a Walgreens or a Metro Market or a Pick and Save where they can get vaccinated, or a public health site. There are many options. So we think that is a key role that you can play. We know that employers are a very trusted messenger for their employees around these kinds of matters. And so our job as State Health Department is to try to equip you with the information and the facts that you need in order to translate that information. And again, I've shared some resources that will be coming to you shortly. Second, and kind of the corollary to providing education, is to reduce whatever barriers your employees may otherwise face to getting vaccinated. So we know that things like transportation to a vaccine site may be a barrier for some of your employees. Do you have a role to play in that? Or could you partner with local health departments or with health systems and others to make sure people have easy access to the vaccine wherever it's going to be given? Same thing around hours of work and time of day when vaccine is likely to be made available. So if you have the option to bring a clinic in, that obviously it makes it very easy for your employees. If you can't do that, can you allow your employees to get vaccinated on paid time so that they don't have to worry about a choice between getting vaccinated and losing some work hours? Strategies like that have been shown to be very effective. In addition, we have received a number of questions about incentives and other strategies to help employees feel that much more comfortable and remove that many more barriers to getting vaccinated. I will be quick to say that we are the health department, not the employment policy department, so I definitely want to stay in my proper lane here. What I can tell you is that in large studies of lots and lots of workers around flu vaccination, we know that modest incentives to really encourage people to take that next step have been effective. We know that some employers around our state are looking at that already, so we'll just lift that up for you as well. And the last thing I'll say is I really do want to commend the Greater Milwaukee Committee for your broad agenda around not just COVID response, but also the entire recovery of the community and the particular focus that you have around racial equity. We know that it will take the leadership of this group and so many others to make sure that we can continue to make investments in our communities and really rebuild so that the fractures in our community that COVID has illuminated so dramatically can really be healed, and we can be even stronger as we move ahead. So I'll leave it there in the interest of time, and thanks again for the opportunity to be with you.
Thank you, Secretary Timberlake. Those are great, insightful comments, and we appreciate the work you're doing. And we're so glad to have you back on the team and leading this effort at such an important time. We look forward to your continued leadership during the critical time. Next, we welcome Mara Lord, Senior Vice President of University Engagement and Strategic Planning for the Medical College of Wisconsin. Mara's played a key role with the Vaccine Integrated Communications Outreach and Community Mobilization Coalition. And when I referred earlier to the groups that our advisory committee is going to be working with, I mentioned VICO, and that stands for. VICO is focused on creating shared and accurate information and messaging throughout our region to meet the 80% herd immunity goal. Welcome, Mara.
Thank you so much, Greg. I really appreciate it. So I'm actually here on behalf of the Milwaukee Unified Emergency Operations Center, as if all of you needed one more acronym. That is the UEOC. And that group was stood up by Milwaukee County and the 11 municipalities that are part of Milwaukee County last year at this time for COVID-19 response. And just in December, the group also stood up the Vaccine Coordinating Committee and then this Vaccine Integrated Communications and Community Mobilization. So I have a lot to share with you about what we're doing locally. I have to say that Dr. Raymond, Mr. Daniel, Secretary Timberlake provided wonderful setup for much of this. And so let's go to the next slide, Melissa. Thank you. So you've already heard this, 80% of our population needs to be vaccinated. And what that equates to in Milwaukee County is 578,000 adults. So the goals of the UEOC, one is to get to that finish line. And a number of you have heard me say this before. Let's get back to who and what we love. Let's get back to who and what we love. And the vaccine provides the fastest, most efficient way to do that. But there's another goal here that we have, and Mr. Daniels really, I think, emphasized this extremely well. He said we need a sustained effort to address social determinants of health. And when we think about the vaccine, I mean, this has become the conversation of now. And Secretary Timberlake saying it's only been 13 weeks. I don't know. I think it feels like a day or a year. I'm not sure. But honoring people and meeting people where they are and encouraging personal choice and encouraging that personal choice to be an informed choice is absolutely essential for everything that we're doing. We're recognizing the limitations that exist, and I'll talk about those more. Next slide, please. So what I'd really like to talk about today is vaccine intent. And this continuum in the middle of the slide shows from left to right, not intending to intending. And, many of us can probably quote these numbers. 40% or so have said, I'm not intending to get the vaccine, or I'm questioning, I'm not really sure. 60% or so have said, I'm open to it, but I'm uncertain, or I don't have enough information, or I'm intending. And now we have a growing number who have either been fully vaccinated or received at least one dose. What I'd like to focus on this slide, though, is language. So on the left-hand side where it says not intending, many surveys are using language such as against, or resistant, or even anti-vaxxers, you've heard. We're encouraging that the language change in this community. In this community, we want to be open. We want to not create defensiveness. We absolutely want to bring everyone along as much as we can. And if you look in the center of that continuum, I have a note there that says movable middle, and I'll get to that in a moment. So put a pin in who we think are the movable middle and the individuals who we believe and are fairly confident we can encourage to make a personal choice toward vaccine. Next slide, please. So here is a snapshot of vaccine intent by race, ethnicity, and age. And if your eyes can follow along that yellow, which are the individuals who are open, but still a bit uncertain. These are the individuals that we're really targeting and focused on. And then those also in the orange. So you can see that, but by race and ethnicity and age, the intent changes. Next slide. So here we have a snapshot of the movable middle, the individuals who research has shown, and this is largely data through the Ad Council, through Pew Charitable Trust, and the Kaiser Family Foundation. And they've continued to bring forth data through a vaccine monitor survey over the past couple of months. They've identified that women aged 35 to 54, those individuals who are largely employed as essential workers, so those might be your CNAs in a health system, or individuals working in restaurants and hospitality, working in transit, etc. These individuals, they're not sure, they're reporting in these surveys that they are questioning, or they may not have enough information, or there's mistrust, but they are open. They could be, these are the individuals who we might be able to move toward informed choice of getting the vaccine. This is the group that we are focused on in this community. Next slide, please. So why are people hesitant? And you've heard a number of, Mr. Daniels, Dr. Raymond, Secretary, all spoke about these to some extent. I just want to emphasize them again. So the research is showing us that people are concerned about safety and side effects. They're concerned about the long-term effects that we may not have the science on yet. There is a mistrust because of disproportionate harm from pandemic and legacy of discrimination, exploitation, and unconsented experimentation. There's a distrust in political and economic motives. And now what's rising up is there is a hassle of getting the vaccine. And I heard Secretary Timberlake say this a couple of times. We need to reduce barriers to getting the vaccine. And there was a New York Times article that just came out on Sunday that really emphasized this. We need to get vaccine to people. We need to meet people where they are in the community. Next slide, please. So here's another, just 6 points on strategies for meeting people where they are. And again, I think Mr. Daniels did a beautiful job of really emphasizing these areas that are alternative communication strategies. Communicating as we usually do is not going to do it. It's not going to get us to that 80% or more. And so just emphasizing forming partnerships with community-based organizations, engaging with those, and centering voices of people who are trusted messengers and have roots in the community, engaging across across many channels, continuing to work toward racial equity and really using that equity lens at all times, and encouraging public ownership. And then number 6, measuring and communicating inequities and vaccine distribution. So if you look at the Milwaukee County and DHS data on vaccine distribution, you'll see a number of data that are very important to take a look at when you think about race and ethnicity and gender as well. There is something that we're doing. We are lifting what's called the EVE model, and that EVE model views community vaccination rates alongside the CDC Social Vulnerability Index. And it creates a score that can inform equitable allocation of the vaccine. It tracks vaccine results, and it will inform us literally on a weekly basis where vaccine is being distributed and how it's being taken up. So that's something that we're going to be using in earnest in the coming weeks. Next slide, please. So now moving to what are some of those messaging elements that really resonate for audiences? Acknowledging concerns and approaching conversations with empathy, reflecting on moments missed. There's great data. And I think Dr. Raymond said it earlier, you know, people want to know if they can hug their grandkids. People want to know if they can get together with somebody who's been fully vaccinated. They can do that in the safety of their home. Those moments are important to all of us, and we've missed them. So reflecting on those is really important. Emphasizing protection for self and others and using a positive tone. I want to just emphasize on the left-hand side in that orange bar, you see that there are lots of messaging elements that have just been rejected across audiences. Talking with negativity and fear, reminding people about how difficult the past year has been, saying it's the right thing to do, or getting back to normal. Those are things that are just not resonating. And we really encourage that we kind of take those things out of our language. Now, the next slide will give you a sense of some messaging elements. And we tried to just simplify this, say this, not that. So you've heard me already say building vaccine confidence. Let's build vaccine confidence in our community. Let's not address the vaccine hesitancy. The change in that positive tone is so important. Let's talk about people who might not be intending to take the vaccine rather than saying resistant or against the vaccine. Let's talk about getting the latest information rather than really focusing on there are lots of things that we still don't know. Let's really focus on getting back to who and what we love and doing the things that we miss instead of saying, come on, you guys, we need to take the vaccine. It's the right thing to do. We need to get back to things, and we know it's been tough. So again, just an emphasis on personal choice and on informed choice. And we thought this might be helpful for all of you. Next slide, please. So now I want to bring it home. All of that really was based in national data. This is local and this is personal. People have to make a personal choice about this, and community immunity happens locally. Vaccine is made available locally. Equity matters, as we've heard. Personal choice matters. This gives you a quick snapshot on some of the messaging that we're developing for across the Milwaukee County community. We have much more to come. This is just a quick snapshot. Next slide, please. So our strategies are, again, really very in line with what Mr. Daniels was speaking about earlier. First of all, we recognize that communicating with our general population, we need to connect with those individuals who have influence. Public health officers, community vaccinators, our health systems and our health centers, our business leaders, all of you, our community leaders, our faith leaders, and then of course through media and influencers. But our strategies with vulnerable populations, they just simply have to be different. And we are, and we're very proud that just last week we heard from Greater Milwaukee Foundation, Zilber Foundation, Bader Foundation, and then also United Way, that they are supporting the first phase of our community mobilizer strategy. And we're very thrilled about that. What that's enabling us to do with Jump at the Sun, Lorraine Lathan leads that group, and the Community Resilience Imperative. It's enabling us to reach out to mobilizers in the community, individuals who have influence, individuals who are trusted voices, who will be trained to host conversations in the community, I mean, deep in the community, and then also for us to leverage community-based organizations to make those connections. This is an absolutely essential part of our strategy in our community here locally. Next slide, please. So just to give you a quick snapshot, what we've already accomplished and what we're doing to build confidence over time. We've identified a large, broad group of collaborators. We've identified a diverse team of individuals from across the community representing different populations at different organizations. We've evaluated the vaccine landscape and research. We've launched healthymke.com. We encourage you to go to that website. It is a wealth of information, and it's meant to bring all things together for COVID. And we've begun our fundraising efforts. We've also connected with the state, with DHS, and with with national efforts to understand what they're doing. We have a lot of work to go, though. We are preparing community-based organizations. We're identifying and training mobilizers. We're launching the business and employer resources. And as Secretary Timberlake said, so critical that employers have take a role in this. And so I spent part of my weekend looking at all of the DHS resources around employer support. We're building a hyper-local toolkit, and we'll be sharing that on March 17th in the GMC, MMAC, Milwaukee Business Journal, MCW, UEOC, acronym crazy, webinar on at 8 a.m. on March 17th. We're also starting to launch our earned and social media, and we're preparing for media placements and many more things to come. And then finally, I just wanted to share with you, if you could go to the next slide, please. You know, your support as leaders across this community, as influence across this community, as employers across our community, so critical. We need your engagement as advisors and connectors. We need for you to share unified messages. Even if something is said in a different channel, we need people to be saying something similar. We need to inspire patience and optimism as we continue to increase eligibility and availability across our community. We're seeking in-kind support for a local media campaign to meet people where they are, to see themselves in our Milwaukee community. And we're also continuing to seek funding support to advance our community mobilization, engagement, and awareness. I'm very pleased. I just mentioned a number of foundations who are supporting this work. I'd also like to thank Visit Milwaukee, Medical College of Wisconsin, Hanson Dodge Creative, a number of others, Milwaukee Healthcare Partnership, who all are already contributing dollars and contributing time. We've raised about $250,000 so far, and we've also secured about $150,000 of in-kind so far. And we need to make this happen. And back to Mr. Daniel's words, that we really need this to be a sustained effort over time. Make sure we get back to who and what we love, and then ensure that we continue with that equity lens going forward. That's it. Thank you.
Thanks, Mara, and thank you for the work you're doing with VICOM and the alphabet soup of acronyms that you're involved with, but you are doing important work, and we thank you. We look forward to continuing to work with you on our upcoming vaccine series. Our final speaker before Q&A is Christy Garcia-Thomas. Christy is the Chief External Affairs Officer for Advocate Aurora Health and a GMC board member. Christy's role during the pandemic is leading the health equity and community vaccine strategy. Welcome, Christy.
Thank you, Greg, and thank you to all the panelists. Obviously, it's all things COVID, all hands on deck at all times, and all of us can play a role in that. And just to piggyback on what Mara shared around building confidence over time, it is so critically important that we stay vigilant on building that confidence over time. Just as a data point, if you think about the flu, we've had the flu vaccine available in our country for many, many years. However, the data says that on average, about 60% of the Caucasian population gets the flu vaccine each year. And then, obviously we'd like to see that number as a healthcare system be higher than that. But then if you break it down into our communities of color only get the flu vaccine at around 40%. And then our African-American community is more like 25%. So people are going to be at different places at different times in terms of their acceptance and readiness. So we've established at Advocate Aurora Health a Get Ready campaign, which is all about our education and outreach efforts, which I'll talk about here in a minute. But it's really to make sure that, as we're inviting our patients to come in and get a vaccine, that they're ready to make that appointment. We can invite them, but at the end of the day, it's their choice whether they come in to get the vaccine. So a lot of work has to be done there, and that has to be done through partnerships. Really grateful for all of the foundations that Mara shared who are getting behind these efforts, because it is going to take a community-wide effort to ensure that we get to herd immunity and we have equity in the work that we're doing. So I'm going to go briefly over a few slides just to give you the lens of one healthcare system, Advocate Aurora Health System's strategy around the COVID-19 vaccine. We have a very complex and multiple approach to our vaccine strategy, But the one key focus to all of our strategy is making sure that equity is first and foremost a part of every decision that we make as we look at how we distribute the vaccine to our patient population and to our community. So what I want to talk about first is really around our prioritization around the COVID-19 vaccine, obviously following the CDC and state guidelines on 65 and older. But we have an algorithm in terms of how we sequence and invite our patients to come in and get the vaccine. It's based off of age, comorbidities, and other risk factors, including those that live in areas disproportionately impacted by COVID. Some of the health conditions considered but not limited to are obesity, diabetes, heart condition, and lung disease. To date, we have administered over 235,000 doses of the vaccine across our system in Illinois and Wisconsin. More than 115,000 doses have been provided here in the state of Wisconsin, and 53,000 in the greater Milwaukee area. Of those numbers, we've also been able to provide close to 17,000 to unaffiliated healthcare workers in the state of Wisconsin. Next slide, please. To support our patient efforts, we're piloting a workflow where in our clinics where we have higher percentage of patients of color. As our patients are being discharged from their office visit, we're having our clinical team look to review our charts and see which patients are eligible that have received the invitation to make an appointment. And we're scheduling those appointments for them at the clinic. This is especially helpful for our patients who have been disproportionately impacted by COVID-19 and have barriers to scheduling. John mentioned this, but we know there are huge inequities in terms of access to email, access to text messaging, access to phone. So our pilots are getting tremendous results in terms of being able to schedule the appointment for the patients while they're right there in our clinics and getting them to one of our closest clinic sites that we have available. With our clinics, we're using our relationships because we know that having a trusted source, someone that our patients trust, is really important to the acceptance rates of scheduling. Next slide, please. We aren't working in this vacuum by ourselves, but rather really looking to partner with many, many people and organizations in the community. We're partnering with community-based organizations, with our FQHCs, with our faith partners, with the city, county, and state in managing our COVID vaccine response. We're doing everything that we can with the vaccine supply available to us at this time, and in partnership, we are working in our strategies of making sure we have very large clinic sites, which is, you'll see 2 of them here, along with some of our smaller sites that are at all of our hospitals. And we're in the position to get some of our smaller clinics up and running, such as Midtown, which is in the African American community, and then Walker's Point Clinic, which is in the Hispanic community here soon. As we think about just the UW-Milwaukee partnership, we had a soft launch last week and are expected to vaccinate over 1,000 individuals this week. We have the capacity to do up to 2,000 per week. It is a partnership with UWM, and the School of Nursing is helping to staff some of the clinic demands for us. Advocate Aurora Health is managing the vaccine. We know that transportation is a significant barrier, in particular for our communities of color. We take a look at our data, and we were able to review that based off of the data that we have, there are 5 zip codes in Milwaukee County where there are higher rates of socially disadvantaged neighborhoods, households without vehicles, and a disproportionately high rate of COVID positivity cases. So we know that by focusing in on these 5 particular zip codes and addressing transportation issues is going to be key, whether it's getting them to the UWM Milwaukee site or to a closer clinic in their neighborhood, as we are opening up some of our smaller clinic sites as well. We've also partnered heavily with our FQHCs. We know that they have the access to the vaccine right now, and we have staffing that we can offer to them. So we've been providing staffing to some of the FQHCs so that they can provide more vaccine to the patients within their clinics. We know that this is a good way to reach some of our communities of color. There's already a trusted relationship with the FQHCs, and by our partnership with them, we can help them reach more of their patient population. Next slide. Next slide, please. Thank you. So as far as our education and outreach, it has been something that we've been doing continuously over the past year, whether it was education on testing and then moving to the vaccine. And it's really important to recognize the importance of disseminating information to the public about the COVID-19 vaccine. Our strategy is to execute on some of the new and existing education outreach opportunities across our diverse communities. And our goal ultimately is to decrease vaccine hesitancy and increase vaccination outcomes. We have a 4-step approach. First and foremost is listening sessions in our communities of color to better understand their concerns. And as you think about what Secretary Timberlake spoke about, regarding what you as an employer can do, doing listening sessions with your employees is going to tell you exactly what your employees are thinking and help you develop solutions to overcome some of the challenges that your employees might be facing. Patient-facing education materials to inform patients about the vaccine. And it's really important here that we think about doing this in multiple languages. And English is not the first language for large portions of our community throughout the state, and making sure that we're addressing the educational materials we have in multiple languages. We also developed a multimedia community outreach touch points using local community influencers. As Mara talked about, you really have to have a trusted source in the community to help deliver the messages and educate and influence. So we've been doing some of our community outreach in barbershops, with our churches, with some of our community partners who we know are trusted sources for the communities that they serve. And we've also engaged in community listening sessions and social media town halls with community members to educate and then to answer questions from them with our clinical staff. We have done a number of Facebook live sessions. We've done several of those Facebook live sessions in Spanish as well. Our social media efforts have garnered over 1 million impressions. Our town halls have garnered over 260,000 English views and over 110,000 in Spanish views. I think to echo Mara's talking points on the multiple challenges that our community faces in terms of the hesitancies they have, it is really going to take a multi-pronged approach for us to meet people where they at, understand what their concerns are, and really begin to have transparency and conversations and ways to get people to become more comfortable and become more ready to get the vaccine. With that, I'll stop there. And again, thank you for your time.
Thanks so much, Christy, for that important information and all you do for us, and for volunteering to join me on the committee. We've had so much information in the meeting that we're running a little late, but we've got time for some Q&A with the panel. And we may only get one question, but I've got one question I think actually everybody which can address, and someone can volunteer to go first while the others think about their answer. I know what it's like to be on a panel and thinking, oh, don't call on me first. But the question is this: Oh, here, before we get to the questions, let me tell you the poll results, in case anybody wants to know. You take a poll, you want to know how it turned out, right? First and foremost, who's going to take the vaccine? Well, good news in our group, 96%, only 4% are not. So we are going to help get us to 80%. And I do like having a goal as a community. It speaks to, we talk about, I've always said one of our great community, crown jewels is our healthcare. And it's, as we look to attract people to come to Milwaukee, to show that we have great healthcare for everyone in the community, I think is a great calling card. And so having all these great professionals help get us to 80% and be a great exemplar for the country will be great for our community. As for what people need, the top three, I'll just give you the top three, and really 1 and 2 are sort of an overlap. But number one, the people want vaccine access information, resources to build confidence. So they want to be able to tell people where to go get the shot and how to communicate to them that this is something that they should do. And information about employee vaccine clinics, which is sort of repetitive, was number 2. And number 3 was steps on returning to in-person. How do we get back to work? I think people realize it's great that we can be on Zoom, but it doesn't really replace being together, which is a good thing. So with that, when this meeting is over, what would you ask those who are listening to make their top priority? What can they take into the community? Whoever wants to go first, join in, and then we'll let others follow.
Hey, Greg, I'll start.
Thank you, John.
Vaccines are safe and effective, and they're our shot to have a better future, and that we all need to be champions for equitable distribution of vaccines.
Greg,
Hey,
to
Greg.
build on that, something else that we're thinking about a lot that hasn't come up quite as much yet in our conversation is the strategies that we're all going to need to deploy around the reincorporation of people back into our workplaces, reincorporation of children back into school for those kids who've been learning virtually, part-time or full-time, what it's really going to mean for us to be in community with one another again. And again, I think that the Greater Milwaukee Committee has many excellent plans laid out for exactly how to do that, but that's something that we're thinking about a lot for the state as an employer.
Hey, Greg, this is John.
Yep.
The one thing I would say is we really have to keep a focus that the entire community has to have the benefit of the remarkable science that's out there. And so some of us will get the benefit of that earlier, but it is very important for an equitable community not to lose sight that, the least of us also have to have the benefit of the great health care we have in this community.
Thank you, John.
I'd like to add just, so something that people can do literally today is think about the organizations, the community-based organizations, faith-based organizations, et cetera, who have an influence in the community. And let's find a way to get to those leaders and those individuals. And I know Christy mentioned a number that Advocate Aurora is reaching out to, that we're reaching out to, but we know that there are many more. So let's try and blanket our community and connect with people and meet them where they are.
I think the tag on that I would offer is that it's really important to build relationships across differences. We tend to build relationships with people who look like us and think like us and act like us. And there's a whole world out there of people that aren't benefiting in the same way that some of our community is. And so building relationships, building trust, listening, and then really looking to provide solutions to create sustainable change in our community is going to take a tremendous amount of community organizations, leadership, business leaders leaning in to make a difference. I mean, COVID-19 put a bright light on the health inequities that exist in our community, but they've existed for hundreds of years. They don't go away when COVID goes away. And we have to recognize that we have to all be a part of that solution.
Thank you, Christy. I have a question for Dr. Raymond. Dr. Raymond, what do you anticipate the trajectory of the pandemic will be over the next 12 months?
Well, the optimistic part of me would predict that we're going to stay ahead of the pandemic, that everybody's going to monitor their personal behavior, that the people that make policy decisions are going to make wise decisions, and that we'll stay ahead of these variants. And I firmly believe the science and our vaccine makers will allow us to stay ahead of the mutations. That's what they do for the flu vaccine every single year, so they're ready to do that. The biggest variable, though, is people's behavior, and we just can't let our guard down now. So if everybody is willing to see the light at the end of the tunnel and not drop their guard for the next few months, I think maybe by this fall we're going to be able to feel like it's a new day when we can reintegrate into the workplace and with our families.
Great, thank you very much. And I guess a question that seems interesting now, and maybe one of the reasons that we're focused on this, and anybody can jump in to answer it, but right now it seems like demand is outstripping supply in the vaccine world. Do you think soon we're going to be in the other direction? And I'm presuming an equitable distribution of vaccine per John's point, and an important one. So, if anybody want to react to that, go ahead.
I'll just say at a state level, we are absolutely planning for that. And so that's why I think some of the strategies that have been articulated today by other panelists about here's what we're doing as a community, or here's what we're doing as a health system, or here's what you can do as an employer to help with information and education and get people ready to be vaccinated when it's their turn. That is vitally important, because we do expect at some point that demand is going to tail off, supply is going to continue to increase, and we won't yet be at our 80%. And none of us wants to let that happen.
Thank you. And then, Mara, you've been giving a lot of thought to this too. And what have you seen in other communities that's been successful in building vaccine confidence? Anything unique and different?
So I actually think it's just emphasizing what we've all said over this past hour and a half or so. It is ensuring that individuals who are already trusted and already have relationships, that we bring them in, and we build relationships with those individuals to build the conversations and the relationships with other individuals in the community. That is what we're seeing to be absolutely the most effective. Again, I can't say it enough. Meet people where they are. Honor people for their ability to make a personal choice and an informed choice.
Great, thank you. One last question that someone threw in, I think it's an important one. I know someone will want to jump on this, and that is, there have been questions about the efficacy of the J&J vaccine, and what. And I know that Dr. Raymond, you alluded to this a little bit in your presentation, but what should the takeaway be for everybody on that?
Well, Secretary Timberlake probably is the most important spokesperson for the state, but I would start by saying all three vaccines that currently are under EUA are extremely safe and extremely effective, and it is very difficult to do an apples-to-apples comparison of the vaccines. They're all really, really good. Just some experience from our vaccine clinic. We have people that have told us they won't get the J&J vaccine because they don't think it's as effective. And we've had other people cancel their clinic appointment to say they believe in the J&J vaccine and they only want to get the one shot.
Thanks, Dr. And Greg, if I can add quickly, the three quick talking points that everyone should feel free to use. All of these vaccines have been proven to be incredibly effective against symptomatic COVID infection, which is what we're most concerned about. So anywhere from 65 to 95% effective, which, comparing it to the flu, that's doing real well. Second, all three vaccines are highly effective, better than 89% effective against preventing severe COVID-19 that requires hospitalization. And third, in clinical trials, not a single person who got any one of the three vaccines died from COVID. So if we think about, mortality and severe morbidity being the two things we are most concerned about, all three vaccines have performed amazingly well.
Great. Thank you very much. Well, with that, I'm going to close the Q&A, because if I'm going to only get one thing right today, it's going to be end our meeting on time. Thank you, Dr. Raymond, John Daniels, Secretary Timberlake, Mara Lord, and Christy Garcia-Thomas for your time and insight today. As mentioned in my opening remarks, this information is essential for our membership and our ability to support the health and safety goals of our community, and to make the critical decisions for our organizations. Thank you for your round-the-clock work. We will send a video copy of this meeting via email later this week with the poll questions that were answered earlier, although I gave you a little bit of a teaser about it. And again, if you're interested in participating on the Vaccine Strategy Committee, please reach out to myself, Julia, or Heather. We will see you at the April 12th meeting with guest speaker Tommy Thompson. This meeting is adjourned. Thanks, everybody.